Imagine a world where getting sick doesn't just threaten your life. It threatens your entire future, where a single illness can push a family from stability into poverty overnight. Now ask yourself, is disease just a health issue, or is it actually an economic trap? The relationship between disease and poverty is not coincidental. It is deeply interconnected in what economists often describe as a vicious cycle. Poverty creates conditions in which diseases can easily spread, while disease, in turn, makes individuals and families poorer. People living in poverty often lack access to clean water, proper sanitation, nutritious food, and adequate housing, all of which are essential for maintaining good health. When these basic needs are unmet, the human body becomes more vulnerable to infections and chronic illnesses. For example, overcrowded living conditions can accelerate the spread of communicable diseases, while malnutrition weakens the immune system, making even minor illnesses more dangerous. Thus, poverty does not just limit financial resources, it actively increases exposure to health risks. At the same time, limited access to healthcare services further intensifies this problem. In many low-income communities, hospitals and clinics may be scarce, underfunded, or too expensive for ordinary people to use. Preventive care, such as vaccinations or regular checkups, is often neglected because individuals simply cannot afford it or are unaware of its importance. As a result, diseases that could have been prevented or treated early become severe and sometimes life-threatening. This lack of timely medical intervention not only worsens health outcomes, but also increases the long-term economic burden on families. What could have been a minor, manageable condition may evolve into a chronic illness that requires ongoing treatment and expenses. When illness strikes, its economic consequences are immediate and often devastating. A sick individual may be unable to work, either temporarily or permanently, leading to a direct loss of income. For families already living on the edge, even a short period without earnings can disrupt their ability to afford food, pay rent, or meet other essential needs. In many cases, other family members must step in to provide care, which may require them to miss work or school as well. This multiplies the economic impact, turning a single health issue into a household crisis. Over time, repeated episodes of illness can erode financial stability completely, trapping families in a state of persistent poverty. Moreover, the costs associated with treatment can deepen this financial strain. Even when healthcare services are available, they often come with significant expenses, including consultation fees, medication, transportation, and sometimes hospitalization. For low-income families, these costs are frequently paid out of pocket, forcing them to make difficult choices between health and other necessities. Some may borrow money at high interest rates, sell productive assets like livestock or tools, or deplete whatever savings they have. These coping strategies may provide short-term relief, but often lead to long-term financial insecurity. As a result, a single illness can have consequences that last for years, if not decades. The impact of this cycle extends beyond individual households and affects entire communities. When a large portion of the population is unhealthy, the overall productivity of the community declines. Workers may be absent more often, perform less efficiently, or be unable to contribute at all. This reduces economic output and limits opportunities for growth and development. Businesses may struggle to find healthy, reliable workers, and public resources may be stretched thin as governments attempt to respond to widespread health challenges. In this way, the link between disease and poverty becomes a broader economic issue, slowing progress and reinforcing inequality at a societal level. Importantly, this vicious cycle is self-reinforcing, meaning that once it begins, it becomes increasingly difficult to break. Poor health leads to reduced income, which in turn limits access to the very resources needed to improve health. Children born into such conditions are particularly vulnerable, as they may suffer from poor nutrition and limited access to education, both of which affect their long-term prospects. As they grow up, they are more likely to remain in poverty and experience similar health challenges, perpetuating the cycle into the next generation. Without targeted interventions, such as improved healthcare access, better living conditions, and increased awareness, the connection between disease and poverty continues to trap millions of people in a loop that is both economic and human in nature. Healthcare costs are one of the most significant, yet often overlooked drivers of poverty, especially in low and middle-income countries. For millions of people around the world, access to healthcare is not free or adequately subsidized, meaning individuals must pay for medical services out of their own pockets. These expenses can include doctor consultations, diagnostic tests, medications, hospital stays, and even transportation to healthcare facilities. While such costs may seem manageable for wealthier individuals, they can be overwhelming for low-income families. In many cases, even a minor illness can require spending that exceeds a household's monthly income, placing immediate financial strain on already fragile economic situations. One of the most concerning aspects of healthcare expenses is their unpredictability. Unlike regular household costs such as food or rent, medical expenses often arise suddenly and without warning. A person may appear healthy one day and require urgent medical attention the next due to an accident or sudden illness. This lack of predictability makes it extremely difficult for families to plan or save adequately for healthcare needs. As a result, when medical emergencies occur, families are forced to make quick financial decisions, often under stress and without sufficient resources. This reactive approach to healthcare spending frequently leads to poor financial outcomes, as families may resort to borrowing money or delaying necessary treatment. Out-of-pocket healthcare payments are particularly dangerous because they can push families below the poverty line. Economists refer to such expenses as catastrophic health expenditures, meaning that the cost of treatment consumes a large portion of a household's income. When this happens, families must cut back on essential needs such as food, education, and housing in order to afford medical care. For example, a family might reduce the number of meals they eat each day or withdraw children from school to save money. These sacrifices may help manage immediate healthcare costs, but they have long-term consequences that can worsen poverty and limit opportunities for upward mobility. In many cases, families cope with high healthcare costs by selling their assets or taking on debt. Productive assets such as land, livestock, tools, or small businesses are often sold to cover medical expenses, which reduces a family's ability to generate income in the future. Similarly, borrowing money, especially from informal lenders who charge high interest rates, can lead to a cycle of debt that is difficult to escape. Over time, the burden of repaying loans combined with reduced income, generating capacity, can leave families in an even more vulnerable financial position than before the illness occurred. This creates a long-lasting economic impact that extends far beyond the initial health issue. Another critical issue is the inequality in access to health care based on income levels. Wealthier individuals are more likely to afford high, quality medical services, receive timely treatment, and recover quickly, allowing them to maintain their economic stability. In contrast, poorer individuals may delay seeking care due to cost concerns, leading to the worsening of their condition. By the time they finally seek treatment, the illness may have progressed to a more severe stage, requiring more expensive and intensive care. This not only increases the financial burden, but also reduces the likelihood of full recovery, further limiting their ability to work and earn income. In this way, healthcare costs not only reflect existing inequalities, but also deepen them. Furthermore, the lack of financial protection mechanisms, such as health insurance or government-funded healthcare programs, exacerbates the problem. In many parts of the world, health insurance coverage is limited or non-existent, leaving individuals fully exposed to the financial risks of illness. Even where insurance exists, it may not cover all treatments or may involve high premiums and deductibles that are unaffordable for low-income households. Without adequate support systems, families are left to bear the full cost of health care on their own. This absence of financial protection transforms healthcare from a basic human need into a significant economic risk, reinforcing the cycle in which illness leads to poverty and poverty increases vulnerability to further health challenges. The loss of productivity and income is one of the most immediate and visible economic consequences of disease, affecting individuals, households, and entire economies. When a person falls ill, their ability to work is often reduced or completely halted, depending on the severity of the condition. For individuals who rely on daily wages or informal employment, even a single day without work can mean a day without income. Unlike salaried workers who may have access to paid leave, many people in low-income settings do not have such protections. This makes them particularly vulnerable, as illness directly translates into lost earnings, disrupting their financial stability almost instantly. The situation becomes even more challenging when illnesses are prolonged or chronic. Diseases such as tuberculosis, malaria, or long-term conditions like diabetes can keep individuals out of the workforce for extended periods. During this time, not only do they lose income, but they may also incur ongoing medical expenses, further compounding their financial difficulties. In some cases, individuals may never fully recover their ability to work, especially if the disease causes permanent physical or mental impairment. This can lead to a complete loss of livelihood, forcing families to depend on limited savings or external support, which may not be sustainable over time. The impact of lost productivity is not limited to the individual alone. It extends to the entire household. When one member of a family becomes ill, others often have to adjust their roles to compensate. For example, a working adult who falls sick may require care from another family member who may then have to reduce their own working hours or leave their job entirely. Children may also be affected, as they might be required to help with household responsibilities or income generating activities instead of attending school. This redistribution of labor within the household reduces overall productivity and limits the family's ability to maintain a stable income. In addition to direct income loss, illness can reduce the efficiency and performance of those who continue to work while unwell. Many individuals, particularly in low-income settings, cannot afford to take time off even when they are sick. As a result, they may continue working at reduced capacity, which can lower their productivity and increase the likelihood of mistakes or accidents. This phenomenon, often referred to as presenteeism, can be just as damaging as absenteeism, as it affects both the quality and quantity of work produced. Over time, this reduced efficiency can impact not only individual earnings, but also the overall output of businesses and industries. At a broader level, widespread illness within a population can significantly affect national economic performance. When large numbers of people are unable to work or are working less efficiently, the total productivity of the workforce declines. This leads to lower levels of economic output, reduced tax revenues for governments, and slower economic growth. Key sectors such as agriculture, manufacturing, and services may experience labor shortages or decreased performance, which can disrupt supply chains and increase the cost of goods and services. In countries where a significant portion of the population is already economically vulnerable, these effects can be particularly severe, hindering development and perpetuating poverty on a larger scale. Furthermore, the long-term effects of lost productivity can create structural challenges within an economy. A workforce that is frequently affected by illness may struggle to develop the skills and experience needed for higher paying jobs, limiting opportunities for economic advancement. Businesses may be less willing to invest in regions with high disease burdens due to concerns about workforce reliability and increased healthcare-related costs. This can result in fewer job opportunities and reduced economic diversification, making it even harder for affected populations to escape poverty. Over time, the combined effects of individual income loss, reduced household productivity, and declining national output reinforce the cycle in which disease and poverty continue to sustain one another. The impact of disease and poverty on education is profound, particularly for children growing up in vulnerable households. Education is widely recognized as one of the most powerful tools for breaking the cycle of poverty, yet illness often disrupts access to it. In families struggling with poor health, children are frequently the first to experience interruptions in their schooling. When a child becomes sick, attending school becomes difficult or impossible, especially in areas where healthcare access is limited and recovery times are longer. Even common illnesses can lead to repeated absences, causing students to fall behind in their studies and struggle to keep up with their peers. Beyond personal illness, children are also affected when other members of their family fall sick. In many low-income households, children take on additional responsibilities during such times. They may be required to care for younger siblings, assist with household chores, or even contribute to income-generating activities. These responsibilities often come at the expense of their education as school attendance becomes less of a priority compared to immediate family needs. Over time, frequent absences can lead to disengagement from school, making it more likely that children will eventually drop out altogether. Financial constraints further intensify this issue. When families face high medical expenses, they are often forced to make difficult decisions about how to allocate their limited resources. Education-related costs such as school fees, uniforms, books, and transportation may be seen as less urgent compared to healthcare needs. As a result, children may be withdrawn from school to reduce expenses or to help support the household financially. This is particularly common in regions where education is not fully subsidized, and families must bear a significant portion of the costs themselves. The loss of educational opportunities at a young age can have long-lasting consequences for a child's future. The effects of disrupted education extend well into adulthood, shaping an individual's economic prospects and quality of life. Without adequate education, individuals are less likely to acquire the skills and knowledge needed for stable and well-paying jobs. They may be limited to low-skilled, low-income work, which often lacks job security and benefits such as healthcare coverage. This not only affects their earning potential, but also increases their vulnerability to future economic and health-related shocks. In this way, the lack of education caused by disease and poverty becomes a barrier to upward mobility, trapping individuals in the same cycle that affected their families. Moreover, the intergenerational nature of this problem means that its impact is not confined to a single generation. Children who grow up without proper education are more likely to remain in poverty as adults, and their own children may face similar challenges. Poorly educated parents may struggle to provide a supportive learning environment or may lack awareness of the importance of education and healthcare. This can result in a continuation of poor health practices and limited educational attainment across generations. As a result, the combined effects of disease and disrupted education create a cycle that is passed down, making it increasingly difficult to achieve long-term social and economic progress. At a societal level, the widespread impact of disease on education can hinder national development. An undereducated population limits the availability of skilled labor, which is essential for economic growth and innovation. Countries with high rates of illness and low educational attainment may struggle to compete in the global economy as they lack the human capital needed to drive progress. Additionally, governments may face increased pressure on social services, as a less educated workforce is more likely to require support in areas such as healthcare and employment. This creates a broader economic challenge where the effects of disease and poverty on education contribute to slower development and persistent inequality across society. The burden of disease on national economies is substantial and far-reaching, affecting not only public health systems but also overall economic performance. When a country experiences a high prevalence of illness, the government is often required to allocate a significant portion of its budget to healthcare services. This includes spending on hospitals, medical staff, medications, disease prevention programs, and emergency responses to outbreaks. While such investments are necessary to protect public health, they can place considerable strain on limited financial resources, particularly in developing countries. As more funds are directed toward managing diseases, fewer resources remain available for other critical sectors such as education, infrastructure, and economic development. One of the most direct economic impacts of widespread disease is the reduction in workforce efficiency. A healthy workforce is essential for maintaining productivity and driving economic growth. But when large segments of the population are affected by illness, this productivity declines. Workers may be absent more frequently, work fewer hours, or perform at a reduced capacity due to poor health. In sectors that rely heavily on physical labor, such as agriculture or construction, even minor health issues can significantly affect output. This decline in efficiency not only reduces the income of individuals, but also lowers the overall production levels within the economy, leading to slower growth. In addition to reduced productivity, disease can also discourage both domestic and foreign investment. Investors are often cautious about placing their resources in countries where health risks are high and workforce reliability is uncertain. Frequent disease outbreaks or weak healthcare systems can create an environment of instability, making it less attractive for businesses to operate or expand. companies may face higher costs related to employee health care, insurance, and absenteeism, which can reduce profitability. As a result, countries with a high disease burden may struggle to attract investment, limiting job creation and economic diversification. The economic impact of disease is further amplified by its effect on government revenues. When productivity declines and businesses generate less income, tax revenues also decrease. This creates a challenging situation for governments as they must manage increased healthcare spending with reduced financial resources. The imbalance between rising expenditures and declining revenues can lead to budget deficits, increased borrowing, or cuts in public services. In some cases, governments may be forced to rely on external aid or loans, which can increase national debt and create long-term financial obligations that are difficult to sustain. Moreover, widespread disease can disrupt key economic sectors, creating ripple effects throughout the economy. For example, in agricultural economies, illness among farmers can lead to lower crop production, affecting food supply and increasing prices. In the tourism sector, outbreaks of infectious diseases can deter travelers, leading to a sharp decline in revenue for businesses that depend on visitors. Similarly, manufacturing industries may experience delays or reduced output if workers are frequently absent due to illness. These disruptions not only affect individual sectors, but also have a cumulative impact on the overall economy, reducing stability and growth potential. Over time, the persistent burden of disease can hinder long-term economic development and reinforce structural inequalities within a country. Regions with limited access to healthcare may fall further behind as poor health outcomes prevent them from fully participating in economic activities. This can widen the gap between different areas and social groups, creating uneven development and limiting opportunities for inclusive growth. Additionally, governments that are constantly responding to health crises may struggle to implement long-term economic strategies, as immediate healthcare needs take priority. This ongoing cycle of health-related challenges and economic constraints makes it difficult for countries to achieve sustainable development and improve the living standards of their populations. Breaking the cycle between disease and poverty requires deliberate and sustained investment in key areas such as healthcare, sanitation, vaccination, and education. These investments are not merely social expenditures, they are powerful economic strategies that can transform the productivity and stability of a population. When governments and institutions prioritize public health, they create the foundation for a healthier workforce that is capable of contributing effectively to the economy. Access to basic healthcare services ensures that illnesses are prevented, detected early, and treated efficiently, reducing the overall burden of disease. In this way, investing in health is not just about saving lives. It is about strengthening economic resilience and promoting long-term development. One of the most impactful areas of investment is preventive healthcare, particularly vaccination programs and early medical interventions. Preventive measures are often far more cost-effective than treating diseases after they have progressed. Vaccinations, for example, protect large segments of the population from infectious diseases, reducing the need for expensive treatments and hospitalizations. Similarly, regular health screenings and early diagnosis can prevent minor conditions from becoming severe and costly. By reducing the incidence and severity of disease, preventive healthcare lowers both individual and public healthcare costs, allowing resources to be allocated more efficiently across the economy. Improving sanitation and access to clean water is another critical step in breaking the disease poverty cycle. Many illnesses in low-income communities are directly linked to poor hygiene, contaminated water, and inadequate waste management systems. Investments in infrastructure such as clean water supply, sewage systems, and proper waste disposal can significantly reduce the spread of infectious diseases. These improvements not only enhance public health, but also reduce the time and money that families spend dealing with illness. Healthier living environments lead to fewer sick days, higher productivity, and improved quality of life, all of which contribute to stronger economic outcomes. Education also plays a vital role in addressing the link between disease and poverty. When individuals are educated, they are more likely to adopt healthy behaviors, seek medical care when needed, and make informed decisions about nutrition, hygiene, and family planning. Education empowers people with the knowledge and skills necessary to protect their health and improve their economic prospects. Furthermore, an educated workforce is more adaptable and capable of participating in a wide range of economic activities, which supports innovation and growth. By investing in education alongside healthcare, societies can address both the immediate and long-term factors that contribute to poverty. Another important aspect of breaking the cycle is the development of financial protection systems, such as affordable health insurance and government-supported healthcare programs. These systems help shield individuals and families from the financial shock of medical expenses, ensuring that they do not have to choose between seeking treatment and maintaining their financial stability. When people have access to affordable health care, they are more likely to seek timely treatment, which improves health outcomes and reduces the overall cost of care. Financial protection also allows families to preserve their savings and assets, enabling them to invest in other areas such as education or small businesses. Finally, sustained and coordinated efforts at both national and international levels are essential for creating lasting change. Governments, non-governmental organizations, and global institutions must work together to design and implement policies that address the root causes of disease and poverty. This includes not only funding and infrastructure development, but also awareness campaigns, community engagement, and policy reforms that promote equitable access to resources. Long-term commitment is crucial, as the benefits of these investments may take time to fully materialize. However, the results, healthier populations, increased productivity, and more stable economies demonstrate that breaking the cycle of disease and poverty is both achievable and economically beneficial. In conclusion, the connection between disease and poverty is not a coincidence, but a powerful and persistent cycle that affects individuals, families, and entire nations. Illness reduces productivity, drains financial resources, disrupts education, and weakens economies, while poverty creates the very conditions in which disease thrives. Together, they reinforce each other in ways that make escape increasingly difficult without meaningful intervention. This is not just a health issue or an economic issue. It is a human issue that demands attention from every level of society. The path forward lies in recognizing that improving health is one of the most effective ways to reduce poverty. When people are healthy, they can work, learn, and contribute to their communities. Investments in healthcare, sanitation, education, and financial protection are not costs to be minimized, but opportunities to be embraced. They create stronger, more resilient societies where individuals are empowered to break free from the limitations imposed by illness and economic hardship. Ultimately, the fight against poverty cannot be won without addressing the burden of disease. By prioritizing health as a fundamental economic strategy, societies can unlock human potential, drive sustainable growth, and build a future where no one is forced into poverty simply because they fell ill.